What is the latest on this so-called mysterious disease in Ruangwa district, and how are those with symptoms faring?
Thank you for having me, Beatrice. And indeed, it is a mysterious disease, just like you mentioned, because the government probe is in Lindi, Ruangwa region, Ruangwa ward of Lindi region, south of Tanzania. They have taken samples from the livestock around the premises of which the affected were to check if it was indeed something that might have come from animals. We also know that the government has been following up and has recorded and is tracking everyone who came in contact with the 13 people initially were first diagnosed with this disease about 5 days ago. The government, the regional medical officer for Lindi had reports of this disease about 5 days ago, but was still investigating. The government had not told people what it was until it made sure that indeed it was something that could be considered unknown, after checking for Marburg, for Ebola, for COVID-19 and other diseases, to make sure it is nothing within the spectrum of diseases within that region. And that, you know, Tanzanians usually have tropical disease. They checked everything, but as it stands, the origin of the disease is still unknown, whether it came from animals, whether something came from something else. So the investigation is still ongoing, and with those that are in hospital, they're still you know, faring okay. There have not been any reported new deaths from the 3 that you just mentioned there. So as it stands, the whole country and even the region is following up to find out exactly what is the cause, where did it come from, and you know, what are the possible ways to stop it from spreading.
Well, Daniel, is it clear yet when and where and exactly how the first patients emerged with symptoms? And also, when are the health investigative teams sent to the area expected to give their feedback on what exactly this disease is?
Well, Beatrice, about 5 days ago, two patients walked into the Ruangwa, you know, district hospital complaining of headaches, nausea, dizziness, and of course hemorrhage. And now, after that, the regional medical officer started following up, and then the cases kept increasing. And within about 5 days, there were 13 cases. So that is, like I said, the origins of where it came from are still unknown. Where, you know, what caused it is unknown. Whether these people are from the same proximity or not is still unknown. But we know that the investigation team is hard at work, and the health minister and some of his senior health officials are following this up, and has told the government has told citizens to be vigilant and to report, the citizens in the Lindi area to report in case of any they see any symptom or any other symptoms, or if they suspect they have any of these symptoms that have been mentioned. The government also encouraged citizens to avoid contact with, you know, the people who have been affected. These families are still being monitored to avoid spreading to other people who have not sort of contracted this mysterious disease. But as it stands, Beatrice, it's still a mystery, and the medical team is still doing its investigation, so it's not known exactly when we'll get a concise report on exactly what the disease is.